This is Dr. Tess Garcia of Garcia Family Medicine, and today we're having our first Tess Talk, and we're going to be talking about depression. Depression and anxiety can have a seasonal component. Now, people tend to have more trouble in the darker times of the year. Of course, I'm a little different. I have my trouble around the equinoxes, but other people, it tends to be the solstice that gets them down. It's the lack of light. People who lived in the Arctic had a lot of problems with depression and also suicide because of the darkness that they lived in for about half of the year. So really, what is depression? Because some people think, yeah, you get depressed because things in life just aren't working right. Depression is when you don't have any of those negative things. There's nothing particularly for you to think I'm depressed about, but you're depressed anyway. It's not enjoying things that you used to enjoy all the time. It's wanting to hide away from people, not be around them. I remember many moons ago listening to a talk show, and the commentator was saying, well, everybody gets depressed every now and then. But we're not talking about that response to situations in your life that make you feel down or out of control for a short period of time. We're talking about a person who life is so heavy upon them that they can't have a better outlook. So one of the things, if you are really trying to figure out, am I really depressed? You can go online and look up the PHQ-9. Now, I'm not into self-diagnosing. This is a signal that, hey, maybe I need to go and talk, well, not maybe, I need to go and talk to a doctor. And what kind of doctor do you go to? Everybody thinks psychiatrist, but it takes a long time to get in with psychiatrists these days. And your family, for simple things, like depression and anxiety, your family physician can diagnose and treat you. And that's what we do a lot of here at Garcia Family Medicine, and why we are facing the subject in Tess Talk. Now, one of the things I have heard from people, yes, I had suicidal thoughts back then, but I never told the doctor because I didn't want to get put in the slammer. Just the fact that you have a suicidal thought does not mean that you're going to get admitted. It's having these thoughts enough that you are a danger to yourself or others. It used to be very easy. A family that was having mental health problems, and one of their children or the mom or the dad could just send them to an institution and they're there for the rest of whatever. It's not like that anymore. So when they're trying to decide if you need to be admitted, it's not, has this person ever had a thought, gee, maybe I should just go jump off a bridge? And they're nowhere near a bridge. That's not necessarily a plan. But if it is, when I go out of here, I'm finding the nearest bridge and I'm jumping, that's a plan. So don't be afraid to say, hey, I'm having these thoughts, particularly if you're noticing that thought coming through every day. So I think I've covered pretty much what depression is, and to a certain extent, how we diagnose them. There's a lot of things that go into the diagnosing, and you don't have to be diagnosed by a psychiatrist for it to be really considered depression, and your family physician can provide you with medication and hopefully help you get lined up with some counseling. The major thing about depression is there tends to be two ways of going at it. One is with the talk therapy, working with a counselor and talking things through. The other is medication. Well, basically, studies have indicated that medication and talk therapy are both they're effective. However, a combination of talk and medicine is the most effective way of treating depression. I strongly recommend that you don't go around trying to self-treat your depression. We hear so much about suicides and the family saying, I had no idea they were depressed. You need to make your depression known and seek help. Don't flail around on your own thinking, I've got to do this, and if I can't fix it myself, I must be some kind of failure. Depression is not a failure, but please seek help. If you decide, no medicine, I just want to speak to a counselor, be choosy with your counselors. Don't just pick one and stick with them if they're not getting to your issues. You can always pick someone else. So I think that's pretty much about time at this point. We're going to be making more test talks on different subjects in the future. If you have any questions about what I've said today, please comment, and if we get enough questions, one of our test talk sessions will simply be answering those questions. We're really wanting to hear from you, because the whole thing about Garcia Family Medicine is the doctor-patient relationship. So tune in for the next test talk, and we will say that 10 times quickly. And we will go deeper into this subject, answer your questions, or move on to the next one. So thank you so much for listening.